Hi, I'm Dr. Glenn Corneil, Acting Medical Officer of Health for the Timiskaming Health Unit. I wanted to take an opportunity today with our increasing cases to go through where we're at with THU in our district. And I'm going to share some of our epidemiological slides, some of our data to show people what's happened over the last couple of weeks with THU and talk about a few things as well. So we're going to share the slides here. So just moving forward, a lot of our data that I'm going to be presenting today goes back to August 1st, which really captures the last 4 months as we've dealt with wave 4. So in the last 4 months or so, we've had over 120 cases now in Timiskaming. But of note, as most of you will know, is we've had an extreme surge over the last couple of weeks. For the week of November 16th to the 22nd, we've actually had the highest rate per 100,000 people of anywhere in the province. So Algoma and Sudbury, as we know, are very active with cases as well. But when we factor in our small population, this is actually the highest rate in the province over the last week. And it's over double what we've ever had before with our previous high in April. So this is just a graphic to show a little bit what we've lived through over the last year and a half, almost 2 years now, with the different waves in our area. Wave 2 and 3 were quite busy for us, but wave 4 has really surged over the last week or so. So coming into early November, we started to see an uptick in cases again. But what we started to see in this week or so was increasing cases with evidence of community spread, or increasing cases where we didn't know where somebody had gotten COVID. And when that starts to happen, especially with Delta, unfortunately things can change and explode very quickly. And this is absolutely what we've lived with the last week, and now continuing to see as we move into the week of November 21st. Our highest cases in a single day was 20, which is quite a bit higher than we'd ever had before. And as you can imagine, things are very busy for all of us, but this surge has hit extremely quickly for THU. I wanted to break down this so you can see with wave 1 to 3, for a lot of the province, it really did hit the elderly. We didn't get that to the same degree because we didn't get COVID into our nursing homes. So our elderly did relatively well. But in wave 4, as was predicted, we're seeing a lot of cases in the 0 to 9 or the kids less than 12 who haven't been vaccinated. So this is the third highest age band for us right now. And we're still seeing pretty well, by far the majority of our cases in people less than 50. Also highlighting here that the cases have been throughout our district. And this is certainly an element of concern for us and played a role in the different decisions that we made today. We also know there's a lot of activity in Notre Dame du Nord, and there's a lot of relationships back and forth with both communities. So, but this slide does highlight that our whole district is at risk and our whole district is seeing quite a bit of activity. Vaccination continues to be our biggest protection against COVID-19 and specifically Delta. Our numbers of vaccines rolled out quite quickly at the beginning. We got up to 70–75%, but we've really stagnated as a district over the last month or so. And we're actually behind many health units now. The provincial average is we're also behind it now. And as we've said for many weeks now, we need 90+% protection to really combat Delta. And we are really stagnating around that 87%. Now, we're quite excited to be able to roll out to the kids 5 to 11, which is going to help, but we really need everybody to get vaccinated. And this is a risk factor to our area, the fact that we haven't got up to those 90+ levels of vaccination. We've also updated our number of cases who have been unvaccinated, partially vaccinated, or ineligible to be vaccinated versus the vaccinated rates. We are now up to 75% of all of our cases are not in the fully vaccinated. We fully anticipated that the number who are fully vaccinated is slowly going to start to come up, because as our caseload increases, more and more people are exposed. And while the vaccines are providing excellent protection, especially against hospitalization, ICU admission, and serious infections with COVID, we are seeing some vaccinated people get COVID, especially if their symptoms are mild or no symptoms at all, but those folks are still contagious. Almost always what we see, not always, but most of the time what we see if somebody who's fully vaccinated gets COVID, it's because they've been exposed in an indoor setting, like a home setting, to somebody who's unvaccinated or ineligible to be vaccinated and symptomatic. Our team plugged in all the numbers, and when you factor in our caseload and our population who's vaccinated and unvaccinated, the vaccine benefit is really, really clear. You're 10 times more likely to get COVID if you're unvaccinated in our district right now. That really is significant, and we really need to keep hammering the message home and encouraging people to get vaccinated, including your third dose when you become eligible. So that's some data to share what's happened in our district. The surge has really happened very quickly. And we're really following what we've seen in Sudbury and Algoma over the last couple of weeks. So in light of that, we have made some moves today. I have issued a couple of letters of instruction to businesses and an update to our class section 22 to try to protect the district more, because we do know public health measures work very well. Nobody wants to add more measures, but right now the province direction to MOHs, medical officers of health, is to make your decisions regionally with support from the chief medical officer of health. And we've done so, and we've enacted these measures today. So very much like Sudbury and Algoma, we've issued today a letter of instruction to businesses. We are going to roll back one step in our capacity limits, in our distancing, and our increasing in masking. So we're basically rolling back to where the province was measures-wise back at the end of September, when they moved to open things up a little bit. We know this has a lot of impact on certain businesses, including our restaurants, but we need to do as much as we can to protect those and our district, to try to keep our schools open, try to keep our businesses open, and try to keep our hospital sector and our acute care sector managing. The good news with our surge is we've only had one admission to hospital, and we need to maintain that as much as possible because our hospitals are under a lot of pressures right now. The other thing our letter of instruction does move now, though, is for participants using community-based exercise facilities, sports facilities. Before, if you were a referee, a volunteer, or coach, you had to be vaccinated. We're now bringing this for participants have to be vaccinated as well for use of our community youth facilities. And again, this is much in line with what Sudbury and Algoma have done. Lastly, we've updated our class section 22 order that we brought in last December. This has been updated based on some of the changes in public health management in cases since December. So this continues to be in effect in our district, and it really enforces the urge and the need for everybody who is identified as a high-risk contact or somebody who has COVID to please follow public health measures. We need to follow them because they work very well, and we need everybody's support in this. Other thing that it's important to be aware is that with our surge in cases, our team at THU it's overwhelmed what we can provide by ourselves. So we have enlisted the help of the provincial workforce. So if you have been identified as a case or a contact, you may get a call from a 1-800 number, a 416 or 905 number. Please take those calls. These folks are working closely with us and are helping manage the surge we've had in cases and the very important case and contact management work that we are continuing to do. There's been a lot of exposures in schools, so I did want to comment on that. This is, again, not unexpected. We knew there were going to be a surge in cases in the winter, and we knew the younger kids who haven't been vaccinated are more at risk for exposures. So for parents and guardians and teens and kids out there, we continue to work very closely with your schools and your school boards. If you are identified as a high-risk contact, we will be in touch with you. You will receive a letter with some direction. And thank you for continuing to follow public health measures with respect to our direction to get tested and to isolate. And also you may be getting a call from the provincial workforce as well. Just a reminder as well, though, that there is a difference. For example, if there's a case in a class or on a school bus, that's an exposure. When we see transmission, or if somebody else gets COVID in a workplace or a school, that's when it becomes an outbreak. It does not mean that everybody's gotten it. It just means that we're starting to see transmission in the workplace or the school. So we just need one case to define outbreak, and we continue to communicate with you as best we can and publicly announce when there are outbreaks, though it always does not mean that there's a whole bunch of things going on in that setting. Did want to also comment on vaccination, that we're very excited to be able to roll out the 5 to 11 vaccination starting next week. The vaccines are performing extremely well in Canada, in Ontario, and around the world. And it is by far, no matter if you're 5 to 11 or at any age group, we are far more likely to have a significant consequence of a COVID infection than any possible negative reaction to a vaccine. So we all have individual choices. Our 5 to 11 age group has individual choices, of course, as well. But we are definitely encouraging everybody to get vaccinated. And we've done a lot of great work with our primary care partners to be ready to roll this out over the next week to 3 weeks plus for our 5 to 11 age group. It has been very dispiriting for many of us over the last week, 2 weeks, when we've had such a surge in cases, despite so many of you doing everything that we ask at a public health point of view with respect to vaccination and following measures. But we also knew that the winter was going to be a roller coaster. Unfortunately, we've taken a very steep rise in cases over the last couple of weeks.
Trudy, please call reception.
And the key for the health unit over the next few weeks is when we've seen our surges throughout the first few waves, we've gotten them back down very quickly. Right now, there's a lot of community spread in our district. So we really are urging everybody to be very careful, continue to try to socialize either within your household or with those in smaller groups, especially with those who are vaccinated. To please continue to follow public health measures like masking and distancing. And then if you do have symptoms of COVID, please isolate, please reach out to get tested, and please continue to follow public health direction. So thank you for everybody for continuing to do what you're doing to be COVID wise, to be COVID kind with people who are working at assessment centers, everybody in the school or work setting who are doing what they can to keep everything open, and for public health as we're continuing to help get this district through this next surge and wave of cases. We all have a role to play in this, and hopefully we'll be able to get this wave back down as quickly as we have in previous waves. So thanks everybody for everything you're doing. We'll continue to keep the population informed. We know a number of people are struggling. We know there are a number of people who are identified as being COVID positive or contacts have trouble with this. So please continue to reach out to THU for supports. We have a lot of partnerships where we can help. So thanks for everything you're doing. Stay well, and we'll keep people informed. Stay tuned. Take care.